because this is almost done. All right. So since it's almost 10 minutes, I think we should kickstart from here. My name is Oluwabukumi, and I am the moderator for this masterclass, and I'm honored to be your moderator. So, so far so good. The section has been so impactful and knowledgeable, and I'm very sure that every one of us has gained one or two things from this masterclass program. Not to waste much of our time, we have our guest speaker who is already in our midst for today, in person of Miss Alimat Oluwawumi Olaniyo. So I would like us to have a brief understanding of our background as regards to this topic that we are all concerned about. Alimat is a passionate public health professional and program manager with a wealth of experience in research and social development. She holds a BSc from the University of Ilorin and a Master of Public Health from the University of Ibadan, Nigeria. As the founder and team lead of the AFAY Health Initiative, Alimat has led transformative projects focused on sexual and reproductive health and rights, menstrual health and hygiene, mental health, substance use, and literacy, positively impacting over 3,500 children, adolescents, and youth since 2021. In addition to her work at AFAY, she served as a tax team lead for health and education at, at Their World, a global charity organization, and is also one of the team leads at Careers in Public Health, a vibrant community dedicated to supporting young public health professionals. Alimat is an alumni of the she's an alumni of the Keriton Youth Fellowship, an initiative of the U.S. Consulate in Nigeria, and was a youth ambassador for International Adolescent Health Week in 2021. Beyond her professional achievements, she enjoys reading African literature, spending quality time with family and friends, and exploring new restaurants. We are privileged to have her share her knowledge and insight with us today. Please join me in warmly welcoming our guest speaker, Alimat Omowumi Olaniyo. I'm expecting our chat to be flooded with clapping emojis right now. So permit me to introduce our guest speaker. So our guest speaker, Ms. Alimat, you have the floor. So I would like you to note that this lecture holds for once it's 5:35. Please, we are just going to go on a very short break and then we will rejoin back. Thank you.
Okay, thank you so much. Thank you so much for that introduction. Um, I'm happy to be here this evening and to be having this session with you all. And thanks to Dr. Busayo for the invitation. So, quickly, just before I start, I would like to meet each and every one of us since we are not so much in the room. So, if you are on the call and you just like to give a short introduction, just 1 second introduction of yourself, please go ahead. You can unmute your mic. So, if there are no volunteers, I think I'll just call people as they are on my screen. So, the first person I have on my screen is Francis Iniolua. Please, can you unmute your mic and just do a little introduction?
Good evening, Madam Halimat.
Good evening, Mr. Iniolua. Nice to meet you.
Same here, you're welcome. Thank you so much. We can't
Yeah,
wait to
thank you.
be impacted by your wealth of knowledge.
Thank you so much. Then we have Mr. Akonji Ola. Can you hear me? I doubt that. Then Sheyi Ola Bright. Can you hear me?
Yes, I can. Good evening. My
Good
name is
evening.
Sheyola Bright. I am a sixth-year medical student of Boy University Teaching Hospital, and I'm really excited and I'm looking forward to your session. Thank you very much.
Thank you so much, Miss Sheyi. Dr. Busayo, I'm sure we've all met her, but just a minute to say hi.
All right. Good evening, Alima. Good evening, everybody. I'm Dr.
Good
Olola, and I
evening.
am glad to be here. Thank you so much, Alima, for always coming through for us at all times. And I know this evening will be a blast as we've been having a beautiful section. And I know your section is just going to be a cap to everything we'll be learning. Thank you so much once again.
Yeah, thank you so much. Thank you for the invitation. So I would go right into my presentation. I'm trying to see if I can share my screen now, but um, I've not been able to see. I can't. Okay, can you see my screen? Can you
Not
see my
yet.
screen now?
Okay, yeah, we can see your screen is,
All right. So
yeah.
thank you so much. This is going to be more of an interactive session because I like to know that people can hear what I'm saying part time. So feel free to drop your comment in the chat while the session is going on. Then there will be like short pauses in between for you guys to give input. As much as possible, I want us to feel relaxed and feel free. It's not an exam. We are all learning here, and it's important to have like a two-way communication so that I'll be sure that you can understand what I'm saying. So good afternoon once again. Like the moderator has said earlier, my name is Halima Tolaniyo, and I'll be taking us through the session on support for vulnerable and at-risk adolescents this afternoon. So this is the outline. We'll be looking at some of some of the adolescents who are vulnerable, what constitutes vulnerability, the causes of this vulnerability, and then how we can support them. So here is a quick story. I wouldn't take too much time reading it, but I'll just leave it on for like a few seconds. Then we come back to it at the end again. So the story is just about a 17-year-old teenager who was raped by her boyfriend, who couldn't get justice when she went to the police, and then she couldn't also access service at the health center because they are judgmental and she's a teenager. And then because she wanted to go back to school and she didn't want to keep the pregnancy, she went to a quack and you know got unsafe abortion and then died in the process. So that's the summary of the story. I would like you to like just jot down the vulnerabilities that you can identify from this story in the chat. If there's anyone, just the vulnerabilities that you can identify from this story. What constitutes vulnerability in this story? I'll be on the lookout in the chat to see. So she's 17. She was raped. She didn't get justice. She lives in an IDP camp. I'm already even reading out some of the vulnerabilities. So just identify the ones you can in your own word and then put it in the chat box. So why does this matter? Why do we have to talk about support for vulnerable and at-risk adolescents? According to UNICEF, at least 120 million girls worldwide have experienced forced sexual acts, and the WHO reports in 2022 that complications from pregnancy and childbirth are a leading cause of death among adolescent girls aged 10 or aged 15 to 19. Adolescents are actually at a very critical stage. Um, we like to say that the phase is transitional, and in this transitional phase they are neither children nor adolescents nor adults, so they are somewhere in between. And like many of us are aware, during this phase there's a lot of transformation that goes on in the body. There are biological changes, there are physical changes, there are emotional changes, as well as other changes that go on in their social life, including changing the academic level and intensity of study for some of them. And so this phase is very critical, and it's even a phase of increased vulnerability itself. So now, because of because of the magnitude of this problem, and then how critical this stage is, it is very important to be able to advocate for these adolescents so that they are not left behind and their needs are met. So, who are these vulnerable groups that we are talking about? So, we've said earlier that adolescents are usually um, in between adulthood and childhood. So, they are not adults yet, neither are they like children. So, they are going through like a transitional phase. Vulnerable and at risk adolescents are adolescents who face greater challenges due to social, economic or health related factors. So I'll give an example. For example, there are some states in Nigeria that there is war currently, and in some of these states, the some adolescents have to move away from their community, just like the story that we read in the beginning. They have to move away from their community to live in temporary accommodation, and there have been reports of a lot of violation, going on in some of these camps, despite the efforts of some of the international organizations, to protect some of these girls. But there is a lot of poverty going on in that place. There's a lot of lack of access to basic facilities. They don't even have decent housing, which contributes to their vulnerability. And many of them have lost their source of livelihoods. So at this point in time, there is no economic, they don't have the economic capacity, you know, to be able to fend for themselves and access quality education. So those are factors that make adolescents vulnerable. These are the adolescents that we call vulnerable and at risk. So as for health related factor, we have adolescents who are living with HIV. So like I said there, we have orphans, survivors of sexual violence, adolescent mothers, adolescents living with HIV, adolescents in extreme poverty, those ones from marginalized communities, and adolescents who are exposed to child marriage. So we know that in some parts of Nigeria, child marriage is still a thing, and not just even in some parts, among some people in Nigeria, child marriage is still a thing. And even though now people are trying to modernize it and say, oh, it's early marriage, it's not child marriage, they are not children, it's still um, harmful, and it has consequences for these adolescents. So why should we even advocate for the sexual and reproductive health and rights of these vulnerable adolescents? It is very important for us to advocate for their needs so that we can change social norms and practices, because we already know, for example, child marriage is deeply entrenched in the culture of the places that it occurs. And sometimes when we don't do this advocacy or when we don't try to support them, then many of these adolescents are even further marginalized just being from that community. We also have to be able to promote their rights, to increase access to services and programs, because it has been said that many of the vulnerable adolescents they lack access to healthcare services. Then we have to improve government commitment to promote inclusion, and then to draw attention to existing gap and reach a large number of people. So when we do the work that we do, I believe many of us here in our various capacities, we have advocacy efforts, or we have intention of embarking on this advocacy journey. So these are some of the reasons why we are doing what we are doing, so that we can be able to change social norms at a larger scale. So what are the factors that contribute to vulnerability of these adolescents? I've said this earlier in the beginning of the presentation, that we have poverty. So many times, many of these people are in extreme poverty, and this puts them at a position where they lack agency and then they lack access to basic services. We also have gender inequality, which is part of the social cultural norms as well, and it can also stand alone, because you'll be surprised to find out that even within cases of vulnerability, sometimes female are still not treated well as they should be, and there is still the male preference going on in some communities in Nigeria. We also have harmful cultural norms such as child marriage, female genital mutilation, and so many other factors that are related to cultural and social norms. We have inadequate legal protection and then limited education. I know that in the course of my work, I have found out, and which is also backed by evidence, that the more educated the woman is, the more the probability of the children becoming educated and having a brighter future. So it's very important to make sure that some of these vulnerabilities do not linger on for too long, so that they do not birth an intergenerational cycle of poverty and also trauma and vulnerability. So then going to the next slide, we are getting to the point where we start to interact very soon. So the key vulnerable populations that I'll be focusing on this evening are adolescents who are survivors of sexual violence, because they often face trauma, unwanted pregnancies sometimes, and then social stigma. Then we also have adolescents who are living with HIV. They experience health challenges, discrimination, and limited access to medication. So I've been privileged to work with adolescents in these two categories: sexual violence and also adolescents living with HIV. And in my work with adolescents living with HIV, one thing I've noticed is that there's still like widespread ignorance as to what HIV is, especially um, for people who have HIV. A lot of people feel like, oh, once they have HIV, that's the end of the world. They are just like left to die. And there are a lot of misconceptions and myths that are going on concerning adolescents living with HIV. I was still sharing with someone this afternoon that in my work with persons with HIV, we hug, we talk, we play. There's is really like, it's not a case where you have to go and start running away from them or start dumping them. So you realize that there's still that limited knowledge as regarding adolescents living with HIV. And you'll be surprised that it's quite a number of adolescents who are living with HIV in our communities. We also have pregnant adolescents who are at risk of dropping out of school, financial hardship, and also maternal and child health complication. And we see how that plays out in the next few slides. So for can anyone hear me please? Can you hear me?
Yes, we can hear you clearly.
All right. Thank you so much. Yes, Sheyola Bright said poverty, and Dr. Busayo said she couldn't access SRH service. Exactly. Thank you so much. Actually, those are very valid points from that story. So, sexual violence and vulnerable adolescents. So, sexual violence, like we said, is a predisposing factor to vulnerability. And globally, one in three girls and one in five boys experience sexual violence before the age of 18. I'm sure we all know that adolescents are people who are between the age of 10 and 19. And if we are saying that one in three girls experience sexual violence before the age of 18, it means that if you put three girls in a room, at least one of them have experienced sexual violence if they are under 18. And that's actually very bad, because you cannot imagine how many girls and how many boys have been affected globally. I know many times people don't like to talk about the fact that boys also experience sexual violence, but it's the truth. Even though it is not as prevalent as girls, because girls are disproportionately affected by many of these vulnerabilities, they also experience sexual violence. So, and there are so many effects of sexual violence. In fact, this is just like a shortened form. This does not cover the entire um, effect of sexual violence on adolescents. So we have physical trauma. If you have other suggestions, what are the effects of sexual violence on adolescents? Please, you can drop it in the chat box. I would like to hear from you. As for me, I put physical trauma, psychological distress, increased risk of STIs, including HIV, according to WHO 2022. So is there? Do we have any comments in the chat? Do we have any comments? Okay, none yet. So what are some of the effects of sexual violence? What do you think are some of the effects of sexual violence among adolescents? Anybody? Okay. Neglect, exactly. Neglect. Yes, it is one of the effects of sexual violence on adolescents. So, and most times when adolescents experience sexual violence, the consequences do not really come immediately all the time. Yes, there are times when we have immediate consequences and the ones that we can see and quickly attend to, but there are some that are long term, like the psychological distress, and sexual violence has been linked to to depression and anxiety among adolescents and young people. And we know that sometimes these things do not develop immediately, they develop over a long time as a result of multiple factors. So then we also have that adolescents who experience sexual violence often face barriers to justice. As we can see from the story that was shared in the beginning of the training, so instead of attending to the issue at hand, they started blaming her that, oh, she went there by herself and that's why she got raped. And that's not the issue at hand. The issue at hand is the fact that she was raped. And in that case where she has reported, they are supposed to document it and then follow due process in seeing it to the end. But some of these issues are in my work. I have also found out that some of these issues are more complicated than that, because if you cannot provide evidence, and that's why it is advised that when adolescents or young people or anybody experience any form of sexual violence, especially rape, it's important to go to the hospital before cleaning up, so that they'll be able to gather evidence that they can use in case of prosecution. Also, there's victim blaming in the society. I know that there was a time when Me Too movement was very there was really high on the internet, and people were like, why are they just speaking up now? Why didn't they speak when it happened? And even herself, didn't she enjoy it? And somebody raped you more than once, you did not talk about it. It's later that you're talking. You want to destroy his career. So many talks like that are victim blaming, and it may put other young people off from reporting when they experience sexual violence. So, and also we also have inadequate legal service. So these challenges that I have listed, I would like to hear from each of us. How do we address these challenges? Before I share my slide. Stigmatization, exactly. Thank you, doctor. So how do we address these challenges that come with um, sexual violence? How do you think we can address sexual violence among adolescents? I don't like a silent class. Mr. Inioluwa, Mr. Akonji Ola, and Miss Sheyola Bright. I want you guys to talk. I want you guys to contribute. How do you think we can address sexual violence among adolescents? I'm listening. Anyone, any ideas? There are no wrong answers. I just want to know. I want to hear from you. Okay, Mr. Inioluwa, can you hear me? Can you hear me?
I
Oh,
do not
so I
think
think
he's close to his phone. So I
oh,
don't know. Can
okay.
I answer that question?
Yes, please. You can answer.
I feel on discrimination.
Okay.
Okay, you mean
So
how do we address it?
how do we address yes
Oh,
discrimination?
okay,
Discrimination is one of
awareness.
the issues they face. Yes,
A
exactly.
lot of
Thank you so
awareness,
much.
media
Awareness.
awareness, media publicity, yeah, something like that could curb those things. And at the same time, literally awareness, like something that we're doing right now, like this masterclass, is an awareness on how to. Oh, I don't think Madam Alima is not here anymore. I don't know. Think her network cut us off. Okay, she's still here.
Sorry, I lost you for a minute.
Yes, you did. You did. We can't see your screen again.
I believe
I
creating a friendly, adolescent friendly institution, healthcare services. I think one of the from it was shared last one of the master class by one of the speaker. I was saying that instead of having general access, because one of the things that this lady lacked during the scenario that was painted was because she couldn't access the right and safe facility because that was not
yes.
provided. I believe providing like a safe adolescent friendly healthcare can actually improve, can address this challenge. Like basically, I think one of the suggestion was that instead of having I know we always have pediatrics area, but can we just have a separate where we say, oh, adolescent health services, adolescent sexual and reproductive health services, this is their
Service.
space. And they can come in, like dedicate that in every healthcare facility. We should have that separate place where they can come in, be vulnerable, communicate all their health needs and all of those things. So that was one of the suggestions that was made in one of the
Yeah.
training yesterday, that if we can have
Yeah.
that kind of thing, it will support adolescents and give them the opportunity to express themselves, communicate their needs, and even address and tackle the whole rape issues and unwanted pregnancy. They will be vulnerable enough to share their experience if there's a friendly adolescent friendly healthcare institution.
Thank you so much. I think I should just end the presentation. You said everything. Thank you so much. Thank you, everyone. And I can see the contribution in the chat as well. I want to move on now so that we don't take too much time on this. Yes, those are really valid points. As you can see, that's what I also have here: creating safe spaces, counseling, medical support, and also empowerment programs to break the cycle of vulnerability. Because, like I said, if you are not careful, when adolescents are exposed to some of this vulnerability, then they may not be in a good space to also like raise the future generation, and then we now have an intergenerational problem at hand. So then we have in the next, I think I have 5 more minutes, I'll talk about adolescents facing early pregnancy. Some of them, early pregnancy is also like a factor that contributes to vulnerability among adolescents, and is even so surprising because one of the leading cause of death among adolescents is age 15 to 19, meaning that adolescent pregnancies are linked to higher mortality rates, unsafe abortion. Of course, complication from unsafe abortion can also result in mortality, poor neonatal outcomes because sometimes they are not able to care for their children well, like I said earlier, and then they will not be able to, sometimes they are not able to complete their education. And we all know that most times when they are unable to complete their education, they lack agency even in the relationships that they go into, and then they are not able to promote to pursue economic opportunities like they should. So I would have asked that, how do we address these challenges? But let's just go ahead so that we just take it together. So, how do we address some of these challenges? What I have here is comprehensive SRHR information and services. So sometimes it's not enough to provide services. It's also important to let them know, because you'll be surprised that there are so many of them that are not aware. They don't, like Adasa said in the chat, Miss Adasa. She said that we should create awareness for sexual violence. Yes, we should also create awareness against teenage pregnancy, because you'll be surprised that there are some adolescents from low income communities that do not know where to go and what to do regarding their SRHR. Then it's not enough to tell them that, okay, oh, you can access these services. Tell them where they can go so that the service is readily available and barriers such as cost and other things are also removed. Then we have mental health services, because in my interaction with adolescent mothers, I know that most times there's this psychological distress that comes with being pregnant as a teenager, and the sudden change that comes with it. Also education, putting them back in school, and empowerment program. And so empowerment, I know that word has been really abused in our context in Nigeria. When people say empowerment, say, women empowerment, you are giving them 1 cup of gari, 1 congo of rice. That is not empowerment. Empowerment is ensuring that they are able to, sustain themselves even after the project is done. What they get is enough to, sustain themselves and, get access to basic things. So these are all important for preventing adolescent pregnancy and also ensuring that they are able to, sustain themselves and, get access to basic things. So have about 2 minutes left. So let me just talk about adolescents um, living with HIV. This group of adolescents, their own vulnerability stems from a health challenge, which is HIV. And as you can see here, adolescents account for half of new HIV infections. Yes, there are some people that were born with HIV, but majority of the new cases occur during this adolescent to young adulthood phase, which shows us that if we are able to, implement interventions on time, then many of these adolescents would not be exposed to this infection, and therefore will reduce the prevalence of HIV. And then we will know that we're just focusing on supporting adolescents who are already living with HIV. Then adolescent girls and young women are disproportionately affected. Like I said, by most of these cases, adolescent girls and young women are disproportionately affected. And then access to healthcare services is often hindered by stigma. So most times the society is still very unaware of HIV and how to manage HIV and how to even relate with persons living with HIV. There's lack of adolescent friendly healthcare facilities. You know, there are some facilities you go to, and even the face of the healthcare workers that you meet there, you don't feel safe, you don't feel comfortable talking about even general health problems, not to now talk of something that is as, confidential as sexual and reproductive health. And knowing how some of our communities are judgmental, these adolescents do not have access to these services. Also, there is a lot of poor awareness about HIV prevention and treatment. I have worked on a project, Family Life and HIV Education, in the past, and one of the things that we found out is that you'll be surprised at how many adolescents do not even have information about how to. People still think, oh, by sharing sperm you can contact HIV.
Okay, so Miss Halima, we're so sorry for that. I was trying to communicate the time with you, but I noticed that when I wanted to do that, Zoom log everybody out. So we will just wait for some few persons to join in so that we can start the class. Okay, I think we are complete now. Um, we are so sorry for the net for Zoom logging everyone out at that moment when the lecture was very intriguing. So let's continue with the class. So Miss Alima, you have the floor. You can continue your lecture while you share your screen.
Okay, thank you so much, Miss Adasa. Like, how many minutes do I have left?
For now, you have a few minutes of 30 minutes for your lecture. As at least you can take your lecture, then question and answer. That's it for now.
All right, thank you so much. Just a minute to share my slide. Okay, so please, I need permission to share screen. Okay, great. Okay, can you see my screen now?
Yes, we can
Can
see
you
your
see my?
screen, ma.
Yes. So I was
Yes,
talking
yes, we
about.
can see your
Yes, I think I stopped when I was talking about adolescents with HIV and the vulnerabilities that they face. Is that correct? Is that correct? Can anybody hear me?
Yes, yes.
Okay. Can you hear me?
I can hear you clearly, loud and
Very
clear.
well,
Okay,
ma'am.
so
Thank
I said I stopped at adolescents living with HIV and how we can address these challenges. Is that correct?
Yes, yes.
Yes. So now, the next slide is a question about how do you think we can address challenges that adolescents living with HIV face, especially as I've said earlier that they face barriers in accessing adolescent-friendly healthcare services, as well as they lack awareness about prevention and treatment, and also the stigma in the society. So, how do you think we can fill this gap and solve these problems? Anybody? How do you think we can address the gaps faced by adolescents living with HIV to, reduce their vulnerabilities? So I think while we think through that, I'll just go to the next slide. So what I have on the next slide is how we can address some of these challenges, and I put it there that healthcare providers must implement youth-friendly health HIV services, counseling, and peer support programs to improve adherence and mental well-being. So, in my experience working with adolescents living with HIV, sometimes yes, the as of up until January, I was sure that ART at the moment, due to the changing government policies and the whole USAID funding that has been paused for the moment, I'm not sure as to how available the drugs are. But at January, I know that the drugs were freely and readily available, and all they had to do was go to the facilities, and then they get their weight measured, and then they give them the drugs that they can use for a certain period of time until their next clinic days. But the area where some challenges exist is in how well these services are delivered, because we've had situation where adolescents have said that, oh, in the clinic they feel left out because they separate them from other people. But healthcare workers will tell you that the reason why they separate them is to protect their identity and their privacy, so that other people will not find them. And then the long wait times. Some of them, they don't want to come to the clinic in the morning and wait till like 2 p.m. or 3 before they get access to their drugs. Then another thing is, the although the drugs are free, some of them do not even have the transport fare, to go come to the facilities to get the drugs. So these are some of the issues that contribute to vulnerability among this adolescent population. And I'm sure that we all, as professionals, as SRHR enthusiasts, would work in our own little way to provide solutions to some of these challenges that are faced by this adolescent. And that brings me to the next slide. So, what are the challenges faced by vulnerable adolescents? Now, I've talked about three categories of adolescents. We have those living with HIV, we have pregnant ones, and then we have the ones who have experienced sexual violence. So, some of the challenges that they face, number one, is social stigma. So sometimes you hear people say, oh, rape is not something you should be talking about in public. It happened in private. Some people will even say they want to go and settle it in their family. Then another issue with social stigma is also for parents, for communities of adolescents who are living with HIV, or even parents as well. Sometimes when the parents do not have HIV, there's a lot of should I call it social distancing, and where everybody's trying to avoid them, and this may put them in a bad position, and they don't really feel good about themselves. Another thing, aside from social stigma and for persons living with HIV and adolescents who are pregnant, or adolescents who have experienced sexual violence, is economic factors. So, like I said, it's very likely that adolescents who get pregnant do not get to complete their education, and then this will in turn affect their future outcomes, such as their economic capacity, because maybe they are not able to secure like good jobs that will be able to bring income and lift them out of that cycle. And then the children come and then inherit the vulnerability, and then it becomes an intergenerational cycle of poverty. We also have challenges in their education. So many schools would not want someone who is pregnant to come to school. And then after delivery, some of these adolescents just feel like, whoa, I'm already pregnant, I've given birth. Those people are no longer my mates, or their mates have gone to another class and then they don't want to repeat in the same school. Or so many other issues like that, then they are unable to return to school and complete their education. We also have healthcare. So on this healthcare, I would like to like dwell a little bit because it's multi-pronged. Number one, we have access to other healthcare services among these vulnerable adolescents. So sometimes they have issues such as malaria, they have nutritional issues because sometimes they are not eating well, and then they need to see to consult with maybe a nutritionist and some other services like that. And some of these things are not readily available, especially in primary health care facilities. Then another one is the mental health and psychosocial aspect of it. I feel like a lot of times, because the mental health aspect of this vulnerability is not evident, they are not on the streets. Because according to popular belief, it's only anyone that is on the street that is going through mental health challenges. But from research and from programs, we have come to realize that this is not true. Adolescents can experience vulnerabilities as regards their psychosocial well-being and not be on the street. They don't necessarily have to be on the street. So some of these issues, and like to the best of my knowledge, mental health services are not readily available in primary health care facilities. And the long wait times, the quality of service, the cost of drugs are some of the barriers that adolescents face, that even young people, not just adolescents, face in accessing mental health services. So you can imagine when it is now adolescents that are already vulnerable, maybe due to poverty, and then they will not be able to access some of these services. The next one is legal support. So sometimes they don't even know that these services exist. But when they even now know that the services exist, it's now left for, because some of the services are not pro bono. You have to pay for it. I know about FIDA, like that Federation of Women Lawyers. They offer free services, but it depends on the case. Maybe it's rape and they see that okay, it's a case that they can pursue and stuff like that. But in cases where you have to pay money, an adolescent that has not even eaten in our community, someone that stays in an IDP camp, will she even be able to find their way to legal services, not to now talk of payment for those services? So these are some of the challenges that are faced by these vulnerable adolescents. So then, regarding their sexual and reproductive health and rights, there are particular challenges. So these are the components of SRHR that ideally everybody is supposed to have access to. We have the maternal, newborn, and child health care, which consists of every other services regarding the mother and child, both prenatal and postnatal, and then when they are pregnant. Then we also have cancer diagnosis and treatment, particularly cervical cancer. Then we have family planning services. We have safe abortion service. So this safe abortion services is with a caveat, because in a country like Nigeria, where abortion is not legal, except the pregnancy is a threat to the life of the mother and or the child. So in this case, we know that we cannot really tell young people to go and access abortion services. And then there is a lot of of faith and cultural barriers that comes with abortion services. But even at that, we should let adolescents know that unsafe abortion comes with so many risks. We also have diagnosis and treatment of sexually transmitted infections. Due to the shame and stigma, sometimes the adolescents do not want to go to the facilities to seek these services, and then sometimes they cannot afford the services. We have sexual treatment and counseling. We have gender-based violence, which I have talked extensively about since morning. And then we have antenatal and postnatal care. So for antenatal care, most of the services are close to being free, but sometimes you have to still pay for little expenses. And sometimes the vulnerability of these people do not allow them, to be able to access these services. So as an advocate, what are some of the challenges that you can even face when you are trying to support these vulnerable adolescents? Number one is resistance and stigma. I was privileged to be in a room with a colleague who works on SRHR in the north, and he was telling me that, oh, people in his community judged him for taking care of adolescents who are for of adolescent girls. They called him names that, you a man in the north in this community, how can you be fighting and advocating for women's rights? Then we also have resource constraints. So sometimes we have very big vision, we have very big ambition, we know what the problems are, and then we have an idea of what the solution should be in our mind. But the resources to bring it to reality sometimes are not readily available. Sometimes some organizations would not even fund individuals. Sometimes they want you to be registered, to be a registered organization, and sometimes they want a registered organization that has credibility, maybe that has been in existence for 15 to 20 years. So these are some of the challenges that you can face as a young advocate for sexual and reproductive health and rights for vulnerable group. We also have accessibility barriers, which sometimes, being able to access some of those communities, and then being able to include everybody in the community in those services. So how do we address some of these challenges that I have listed? I think I will take a pause and take some of your comments. How do we address some of these challenges, both the challenges that they face on individual level, the challenges that they face with regards to SRHR, and also the challenges that you can even face as a young advocate? Anybody, any volunteer? How do we address these challenges? Is there anybody who wants to try? There are no right or wrong answers. It's not an exam. Is there anybody who would like to contribute? I just want to hear from you. How do you think we can address some of these challenges that we have listed? Or is there any of the challenge that resonates personally with you as a young person? How have you been addressing it?
I think good evening everybody. Thank you very much for your presentation so far. I've really enjoyed it. I think that one of the ways we can address the challenges, I'm going to be talking about like the financial aspect now, the economical aspect. I think we can encourage some non-governmental organizations partner with partner with this the victims, right? Or even partner with some healthcare facilities like primary health centers to reduce the cost of the treatment and
Yeah.
make some drugs like free. Thank you.
Yes, thank you so much, Miss Shay. That's really, really valid. Yes, they need to subsidize some of the drugs truly. Although like I said earlier, HIV drugs are free, but I'm not sure if it's in all facilities, and I'm not sure if all facilities even have HIV drugs. At least in Ibadan where I am, I know some facilities that, oh, if you go there, they have pepper and apin clinics, and you get access to the drugs for free. So thank you for your contribution. Any other person, how do we address some of these challenges? Michelle has taken the financial aspects, and that's a very good suggestion, by the way. Any other person? So we're rounding up now, so I'm trying to hear from you guys. Any other person?
I think the aspect of resistance and stigmatization, I believe if we can, infiltrate major religious and major stakeholders in the community, like coming using
Yeah.
the perspective of culture to communicate the conversation. Okay, so I was saying there was one idea that I had in my head. I've not implemented it out before. And I think one of the suggestions was coming from the place of being a Christian and using like some scriptural perspective of like the
Okay.
woman with the issue of blood now. And because some white people, if you are on, like, let me address the issue of menstruation. I know we are not talking about menstruation, which is also part of SRH anyways. And some persons in like white garment people believe if you're on your period, you cannot come into the worship center.
Yeah.
And even for
Yeah.
some Islamic people as well, coming from that
Yeah.
place of knowing that, okay, citing an example like the woman with the issue of blood in the Bible has this kind of experience, and Jesus himself actually asked this woman to come in, just creating like a balance of culture and religion. where they
Religion,
can
yes.
resonate with, and they feel like, oh, they start thinking, oh, that's true, this should not be a taboo. Why have we make it a taboo? Like, just seeing a common ground where they can agree to whatever information we want to bring to them. I believe that that's one of the best way we can start. We can even bring an end to stigmatization. I know there's awareness, there's advocacy and all of those things, but really infiltrating culture and religion, and
Religion.
finding a common ground where we all can align. And I believe that's one of the best way we can reduce stigmatization and resistance when it comes to the topic of SRH or unwanted pregnancy, HIV. Basically, I believe firstly infiltrating culture and religion and finding a common ground where we both can, fixate on.
Yes, thank you so much, Dr. Busayo. It's actually very important to find a common ground, and that's true because when we are very religious people in Nigeria, and if you are able to, just break through that religious network, then you would possibly have a lot of headway. And religious leaders have influence, a lot of influence on the way people behave and think. Thank you so much, Dr. Busayo and Miss Shei. So here are some of the ways I have here. I have penned down in addressing the challenges. Number one is capacity building. So many times we've heard that people have spoken that, oh, adolescents with when adolescents go to the clinic and the health workers are not attending to them very well. We know that so many institutions, so many healthcare facilities in Nigeria are understaffed and under equipped. And sometimes, yes, they really try their best to provide really friendly services. But how do you want to provide friendly services when you have like 30 patients waiting for just one person? And so some of these things we have to, look for support system, look for how we can build the capacity and train some of these healthcare workers in providing some of these services. And it's not just healthcare workers alone. We also need to train advocates who are, people who are advocating for these causes. We need to equip them with the right skills, with how to advocate, how to even like pass their message across and influence a lot of people. So another thing is community engagement. Just like you have said, in community engagement, you are not just engaging the community leaders and the community members themselves. You'll be surprised that there are some communities, once you get there and somebody says, oh no, we don't do this here, every other person in that community will follow and say, yes, we agree, this is our leader, he said we don't do it, so we don't do it. So you need to be very careful and sensitive, culturally sensitive to the needs of the community, and engage key stakeholders such as religious leaders, community leaders, women leaders, and so many other people who hold influence and power within those communities. I will take a child marriage project I did in 2 years ago as an example. And one of the ways that we're able to get access to that community is by actually engaging existing structures within the community. Yes, initially there was resistance. Yeah, no, we don't do child marriage. We are civilized people. We are even living in Ibadan. How can we be? It's people that are in the village in the north that are doing it. We don't do it here. And then we now had to come down to their level and be like, oh, we understand. We are not here to judge you. This, that. Then until we now got access to the right set of people, that's when, even without asking, they now started telling us instances of girls that were married off, girls that were taken to the villages at young age and to go and get married, and so many other cases like that. And we're able to, come in and change perception. We also have advocacy. Advocacy, like I always say, is one of the strongest tool of young SRHR professionals, because most times you do not really have the resources to carry out projects as you should. Sometimes you don't have the political power to carry out some of these things. So what you can do is to lobby, to speak with people in power, to speak with people who are concerned, to advocate for these cases, and you'll be surprised at the results that you get. Then we have collaboration. So, like they always say, collaboration against competition. Oh, there's an organization that is already doing something you are interested in. Yes, it's not bad. You can just walk up to them and work together. And like I'll just use the reference from the Bible as an example, that if one is chasing 1,000, two is chasing 10,000, you're not even two as two, you're not even chasing 2,000, you are chasing multiple. So most times it's very important to to come together. And then sometimes it's not just people in the NGO field, you need other professionals such as lawyers to be on the team. So how do you do this? You need to look for a way to collaborate with those people. You need police officers especially in cases of sexual violence. You need social protection in cases where there's sexual violence and you need to move maybe some of these adolescents to a place where they will be safe. So then we now have service delivery. We have to improve the way that these services are delivered. And sometimes that means also mobilizing resources for the facilities so that everybody feels respected, and also the healthcare workers feel fulfilled, in carrying out their mission. Then we have laws and policies. Like I always say, I always tell people, when it comes to policies, see, trust me, Nigeria has some of the best policies. We have HIV policy in Nigeria, we have VAP Act, we have Disability Rights Act, we have so many policies and laws that are supposed to govern if they are adhered to. But when you go and read this policy, you see that okay, sometimes they make a provision that, oh, we are going to create a ministry that will oversee the implementation, or we are going to create a unit within this particular ministry. And then in 2024, the policy was signed maybe probably 2011 or 2008, and up till now, there's no agency that is overseeing the implementation. So in Nigeria, our problem is not really in having policies. We have fantastic policies, but implementation is one of the major problem and challenge that we face. And then people are not even aware of the law. The other day, I was telling somebody that, oh, if you take your child for female genital mutilation, they can arrest you and put you in prison. Oh. Person was like, hey, is it not my child? Did I not give birth to my child? I said, it's because they are not announcing these laws and policies. That's why many people don't know that these things have consequences. So in addressing these challenges, you need to raise awareness, you need to drive laws and policies, because the policy level is like the greatest level of any change that you're trying to make, especially within a country. So yes, you are raising awareness, you are mobilizing resources, you are doing improving access to services. But once it gets passed into laws and policies and it is backed up by implementation, then the work of the advocates, of the CSOs and NGOs is reduced, because then the government will start to run with the vision. So, and then when you are setting goals for these things, it has to be specific, measurable, achievable, realistic, and timely or time bound. So when you are setting goals, you don't just say, oh, I want to stop I want to reduce teenage pregnancy in Ibadan. Ibadan is a big place. How many adolescents do you intend to reach? In how many months? What will you do? How will you measure the changes? And is it achievable? So, for example, you say you want to you want to reduce child marriage in Ibadan by 10 million. How many adolescents are even in Ibadan? Not to talk of how many adolescents are pregnant that you now want to reduce it among 10 million people. So it means that you have to pay attention to the data, especially when you are trying to support these people. Another thing is advocacy, like we said, is action that is taken to influence policies, raise awareness, and secure rights. So another thing is to define your goals and make sure that they are clear and objective. They should not be ambiguous. Yes, I understand that sometimes you are trying to have ambitious goals, but make sure that those goals are things that are can be achieved. You need to identify key stakeholders and influencers, like Dr. Busayo said. For example, religious leaders, community leaders, then craft messages and call to action. So don't be moving around like we like to do. Sometimes some people would have spoken. So you now ask, so what is the call to action? What exactly are you trying to change? The message is already lost in the plenty story that they are writing. So I'm not saying don't like write stories, but make sure that your call to action is very clear. Then you need to evaluate the impact of whatever you do, how many people were reached, how many lives were changed, and all of that. Then these are some of the advocacy skills that you need. You need to network with other people who are in the space, who are even outside the space, that can help you. You need to communicate clearly. You need to conduct research, to be able to understand the issues better. And I think basically that's what I have. So some of the tools and resources that you can use for this advocacy, we have digital campaigns, policy brief, workshop, and seminars. So these are some of the ways that you'll be able to advocate. Don't forget the story that we started with about a 17-year-old girl who was pressured for sex and then eventually raped, got pregnant, couldn't access justice, couldn't access services. She lives in an IDP camp, and she was pregnant and died because she couldn't access safe abortion services. So this is all I have this evening, and thank you very much for listening.
Wow, it's nice having you, Miss Alimat. And then that was a very wonderful lecture right there on advocacy. At least I've learned one or two things in your class. I learned about how to um know what you want in terms of doing your research, the right people to communicate with when you want to do anything about adolescents or advocates. So it's really a very like I said, a very complete section in one, and in just few minutes or in just few time that you are allowed to teach us. So I will say thank you, and I'm very sure that everyone also learned one or two things. So apparently, this section is a section of question and answer. If anyone has any question as regards to Miss Alimat's lecture, please feel free to open your mic, or you know the floor is all yours. You can ask questions.
Good evening, Miss Alimat.
Good
Thank you very
evening.
much for your presentation. I really enjoyed it. I have a question, right? I know you talked about having or assessing safe abortion services, right? I just want to ask, currently in Nigeria, we know that you also mentioned it, and we know that abortion is illegal in Nigeria. Say you're conducting an outreach now, and an adolescent walks up to you, right, a 14-year-old, and she says that she's pregnant and she cannot keep the baby, and she wants to have an abortion. Like, how do you go about that? Do you help her commit the abortion? You talked about if the adolescents are not safe, that you can take some adolescents to like a safe space. Do you take her there? Like, how do you just handle the situation? Thank you.
Yes, thank you so much for that question. So, yes, in Nigeria, like I said, abortion is not legal, and there's a lot of issues surrounding abortion, and especially when it's a teenager who is like 14. One of the things you need to first do is, when Nigerians say we listen, we don't judge, the first thing is to give them that listening ears to express themselves, understand the situation and the circumstances surrounding that situation, then you can refer them accordingly. So for me, in my own advocacy work, I have like a couple of organizations that I work with, and then this is their own area, and I will just refer them, and they will know how to manage the situation. Yes, of course, they may not be able to eventually do the abortion for the adolescent, because of course it's not legal, but there are ways that they can also like handle the situation and ensure that that particular person gets the maximum support that is required. Also, Dr. Buzaya was saying earlier that in the last class, I think that they mentioned that there's need for adolescent unit outside of pediatrics. Yes, that's something that University of Ibadan is in. In fact, I did my master's in child and adolescent health at the University of Ibadan. So it's a separate department outside of pediatrics. It's just child and adolescent health. And the last time I was at the department, I overheard them saying that they are starting an adolescent health clinic. In fact, they've started. All they are waiting for is just to mobilize little resources, and then they are able to, attend solely to the need of adolescents. And yes, that's a step in the right direction, if you ask me. So those are the kind of places that you can refer such adolescents to, and you'll be sure that they can get, you know, services that are required. I mean, it's in UCH, but then it's not in the major UCH, the pediatrics department. It's an institute on its own, Institute of Child Health, and they have a department of child and adolescent health. So, and then there are organizations that handle such cases. You just refer, and then you follow up to ensure that the adolescent is supported. Thank you.
Thank you very much for your response. I just want to I have a follow-up question, if you
Okay,
don't
great.
mind. If you, like, when you're referring this child, right, this adolescent rather, do you involve the parents, because this is a 14-year-old we're talking
So
about?
yes, so usually when it
Mm-hmm.
comes to adolescents who are underage, of course, parental consent is very important. But then again, you are not getting the parental consent by force. That's why I said it's a lot of listening process, convincing process, a lot of um talking and mediation process from both at the back end and then even right there with the adolescent. So there's a way you would handle the situation in such a way that you're not breaking the laws and you are also ethically protecting the rights of that adolescent. It's a different ball game entirely if it's a young person or an adult who is above 18. But when it comes to minors, especially in Nigeria, it's very important to get consent, except in cases. So there are cases, and that's why, like I said, collaboration is very important. When you have a lawyer on your team, you have people from the Ministry of Women Affairs and Social Protection, they will be able to tell you that some of these things go about it, that the child can be safely withdrawn from that environment and then protected, and then the case can be resolved there.
Ms. Alimat, I'm grateful.
Yeah. Yeah. Any other questions, comments?
Thank you so much, Alima. This is actually a very beautiful presentation. At this point, I'm thinking maybe I should take my section or not, because my section should be the last section, because everything has been touched already. I wanted to talk about water pregnancy. Everything has been communicated already. Thank you so much for this beautiful section, and thank you for going all the way. And I love your slides, so beautiful and well communicated.
Thank you. Thank you so much, Doctor. I appreciate it. Thank you for the invitation. And Miss Adasa, thank you for moderating excellently well. Mr. Eniolua, we still not heard from you. I hope you were able to also gain one or two things from this session. Thank you so much. So I think we've come to the end of the session. Miss Adasa.
Yeah, so sorry. My phone was hanging, so I'm trying to don't mind me, please. So that was a very wonderful section, Miss Salimat, and thank you for having us and giving us such a very knowledgeable and impactful class. Um, in absence of no question, I think we've come to a close of this lecture, and we'll be starting Dr. Busayo's section very soon in no time, immediately after this lecture. So this section has come to an end. So thank you everyone for joining, and thank you, Madam Malimat. So
Yeah, thank you
bye.
so much.
Yeah, you're welcome.
Okay, can I just go ahead to share my slides so that I will keep it as soon as possible?
Oh, all right. Yeah, go ahead, please. Do go ahead.
All right. Although I was informed
Mm,
that we might need like a
okay.
15 break after, but let me just go ahead while I share my slide.
Okay. I think we should I don't know how many minute break do we have from here?
How many minutes?
Yes.
I think I just asked, right? How many minutes do we have left?
Because I think we shouldn't start immediately so that we can have more times for so that people can digest what the length. I don't know if everyone is in line with me so that we can go on a very short break while we take your lecture in 15 minutes time or in once it's 7 o'clock. Is that fine, or we should just go ahead with Dr. Busayo's class? Hello, can anyone hear me? All right, so let's just go on 15 minutes break and we'll be right back in after 15 minutes, please. Yeah.